How are you, buddy?
Good, Benny. How are you?
I'm good. I'm good. Thanks for doing this. I wanted to have you on here, um, obviously because of what's going on. But first of all, like personally, as a CEO of your own company, husband, father, how's all this hitting you?
All things considered, it's going okay. We are all healthy here at home. Three kids, school at home. I'm at home working remotely. We're all getting along just fine. From a business standpoint, all of my employees are remotely working as well. But we're super adaptable and doing everything we can to help each other, help our networks, and help our clients.
Great, good. So I was thinking with this pandemic going on, how is this affecting employer healthcare?
It's been interesting. Healthcare and employee benefits has been impacted significantly by this crisis. And I mean, ever since ever since we had like the stay-at-home orders, which is maybe a month ago or 3 weeks ago, it things changed and changed really rapidly. The Families First Coronavirus Response Act came out, and that came out when employers started to lay off employees or furlough employees, and everyone went remote. And what that act does is really protect employee paid leave. And there's a lot of rules and regulations around that. So we were staying on top of that. And then with all the need for coronavirus testing, then there were the carriers and the insurance carriers and how they were going to cover all the coronavirus testing, waiving member cost share. So member cost share is like co-pays, co-insurance, deductibles, and now all insurance carriers are going to waive all that member cost share, saying that we'll take on the brunt of these costs, go get your COVID-19 testing. And that soon turned into kind of one by one with each carrier, turned into insurance carrier coverage for coronavirus or COVID-19 treatment. So it went from testing to treatment. So treatment means like instead of just testing, now it's like office visits, urgent care visits, ER visits, inpatient stays, medical ambulance rides. So it was we saw like a surge of help and flexibility with the carrier markets. We also saw an expansion of telemedicine. Carriers are now starting to have special open enrollment periods. So if you're not on your employer health plan, you have a period now where you can enroll on a plan or change plans. So it's a lot of flexibility out there, which is great. This is a time where members need it. So some of that and much more has really kept us busy. There's just been a flood of information, and it's been really our job to manage all that information, make sure it's accurate, meaningful, and relevant, and then share that with our clients and our networks.
I think that's been for me one of the most. It's been good, but it's also been really annoying. Is the information, the analysis paralysis, basically,
Oh.
just getting a lot. So like right now with companies, what's the advice that you have from your expertise for business leaders?
So while we were watching all that, the legislative changes and updates, policy and rules changes, we're also watching data. And what we're seeing, what's really interesting, is that claims are at an all-time low. Healthcare claims are at an all-time low, as being reported by the insurance carriers. Even their call volumes are very low. And the call volumes that they're getting is about like member cost share or member co-pays. So we're seeing extremely low utilization in claims. So, we're bracing for financial impact because of COVID-19, thinking that it's going to drive up costs. But what we're actually seeing is very little action at all right now. So how is that going to affect us all? We're not quite sure. The reason why claims are really low is that, no one's going to the doctor, no one's going to their specialists or clinics. Millions of elective procedures and surgeries that are normally happening every month, they're not, because really the only treatments that are happening are COVID-19 related. So again, things are really low right now. So advice to employers, I guess, is this is a tough time. We're in a recession. We don't know how long it's going to go for. And employers are, as they are in recessions, they're balancing the taking care of employees with, the financial health of their businesses. So, we're seeing from a diverse set of employer groups, employers laying off populations of employees or furloughing employees indefinitely. Some are really weathering the storm effectively. But in all those scenarios, healthcare, employee healthcare, and health benefits is essential. But it's also really, really expensive. So in a time like this, it feels even more expensive. In fact, there's a stat that employee benefits is number 2 on an employer's balance sheet, right above payroll. So my advice to employers is do what you can to take control of your healthcare costs, take control of your health plans. The best way we know how to do it as benefits brokers and consultants is to self-fund your medical plan. That could be a new topic to some or an old topic to some, but when you self-fund your medical plan, that means you are paying for your medical claims, or you're paying for your healthcare claims incurred by your members or your employees as they come in up to a certain limit. A lot of employers out there, and I'm trying to stay out of the weeds here, but a lot of employers out there are actually fully insured, meaning that all they do is pay a fixed monthly premium to the insurance carriers, and then the insurance carriers pay claims with those premiums that they collected. So what's interesting is that with healthcare claims and utilization being at an all-time low right now, which is being reported, employers who are currently self-funded are likely going to see significant cost reductions this year for their healthcare claims. Fully insured employers they're going to be paying the same amount in their healthcare insurance, their healthcare premiums, regardless of if their employees are going to be using the plan or not. So this is interesting. So, and then as we follow this data, maybe for the rest of the year, is there going to be an uptick in claims utilization? Likely, it's not going to stay at an all-time low. But the fact that we are where we are right now, are the carriers going to be giving out premium decreases when employers are renewing their health plans towards the end of this year or at the beginning of next year? We don't know. It's too early to tell. What's more likely is the continuation of medical trend, which raises healthcare costs every year in the face of contradicting data. So a self-funded plan can really put the proper cost reductions in place. Some of those strategies are like steering employees to non-hospital settings for care, or lower cost prescription drugs, or contracting directly with providers. Those are all things and a lot more that you could do in a self-funded environment. And when these strategies are put in place, employers are at greater control. Control their data, control their current costs, control their future costs. And when claims costs are low like they are right now, then companies and employees will reap those rewards.
Got it. Okay, well, sounds good. Yeah, that's great, man. I don't know that world, obviously, but I figured I've got to know you really well, so I figured you might be able to give some advice that could actually help a lot of people out there, especially in Chicago. So really appreciate you joining for this.
Yeah, Benny, my pleasure. Thank you.